Good afternoon. My name is Dr. Petrikovsky. I'm professor of obstetrics and gynecology, and we'll continue with the series on videos on coronavirus. I got a lot of questions regarding, first of all, why I'm doing the videos. And the reason being is that there is a lot of misinformation in general regarding coronavirus, and also a lot of unnecessary and unwelcome political influence. And that's sort of understandable because it paralyzed not only our country, but the entire world. I also want to put a disclaimer that my views don't represent the views of the institutions I'm affiliated with. Obviously, I'm not an infectious disease specialist, but I'm very familiar with various viruses as a clinician and a researcher. About 25 years ago, myself was Dr. Baker, who is a noted infectious disease specialist, published a paper on a parvovirus in pregnancy. I'm also quite familiar with CMV virus, with the Zika virus, etc. So everybody who is in clinical practice have definitely some familiarity and knowledge of various viruses. The problem with coronavirus that it's extremely unpredictable. In one of my previous videos, I mentioned that a lot as far as outcome depends on the zip code. And that clearly has to do not only with the population, but also with the quality of care provided in different institutions. Some hospitals are much more prepared to take care of the coronavirus. And as you can see, the lowest mortality is in Manhattan. The highest is in Queens and Bronx in New York. And I think that a lot of that, the explanation for a lot of those factors is that Manhattan is the site of the most outstanding, well-run institutions. I will not give any names, but the whole idea is that although it's very difficult to take care of those patients, the quality of the institution is extremely important. I've also received various calls from many people regarding the fact that the information regarding patients afflicted with coronavirus, very often on ventilators, it's very hard to obtain. I just want to advise you that there is so-called a compassionate helper program out of Brooklyn. You can look them up because unfortunately many people with coronavirus die alone because visitors are not allowed. And any medical facility when there's no relatives around, it's very difficult to provide appropriate care and not being scrutinized. So I clearly encourage people to use those services if you need to get information about sick patients who are relatives or family members. Thank you and stay safe.